Hi, my name's Holly and I'm here to talk to you about my clinical exercise management plan. So here we have the patient. She's a female, 17 years of age, and she's been diagnosed with cystic fibrosis. Looking at her medical history, she hasn't had her lungs replaced, which means that her forced vital capacity is still above 30%. However, you probably wouldn't expect this in someone so young. She has no history of bone fractures, which is also really good, as this is quite common in patients due to delayed puberty. We also can see that she's had chest infections and probably repeated chest infections, which enables us to hypothesize that she's probably been bedridden in a hospital setting for long periods of time, which can have huge ramifications both physically and psychologically, and also she does not have an inflamed pancreas. Diagnosis, so she was diagnosed at birth via neonatal screening, which is where they take a small prick of blood from the baby's heel. This usually proceeds to DNA mutation analysis, and once the CFTR mutation has actually been identified, diagnosis will be further tested by a confirmative sweat test. This is because people with cystic fibrosis generally have a high salt and chloride concentration in their perspiration. Lastly, looking at medication, we can see that she has inhaled thrombolysin, which is an antibiotic. However, this normally leads to lung deterioration. Both ibuprofen and corticosteroids are auto-inflammatory medication, and ibuprofen has actually only been shown to be significant in people under the age of 18, so we can see it is still applicable for this particular female. However, corticosteroids and the lung use of corticosteroids can actually lead to a decrease in muscle mass and also bone mineral density. So this will be important knowledge for the development of the exercise management plan. And lastly, multivitamins, which will help with a of deficiencies that many cystic fibrosis patients experience. So looking at the barriers to physical activity, generally speaking, teenagers with cystic fibrosis are less physically active than their peers, and there are actually an array of different reasons for this. So I'm just going to focus on the four major ones that I could find. So firstly, we have adolescent attitudes about physical activity. Particularly with our patient being a teenager, it's really common for both in the healthy and also the diseased population that physical activity will actually decrease in this period due to puberty. We've also got the lack of opportunities, which seems to be a huge issue with cystic fibrosis teenagers, as they actually have limited time due to the time demands of managing such a chronic disease. Disease-related barriers, such as being embarrassed about increased cough and sputum production, and also the discomfort of shortness of breath, have been highly reported to discourage sport in cystic fibrosis teenagers. And lastly, fatigue, which is a really common symptom for cystic fibrosis individuals. So with the patient's age, it may be beneficial to set goals around a particular sport of interest, motivate them to keep up with their peers, and also I think just it's really important to make it social, because obviously socializing is a huge part about being a teenager. So by promoting things where the teenagers can go to the gym with their friends, go for a run with someone else, may be a really good way about going about prescribing exercise. So what is cystic fibrosis? So it's an autosomal recessive genetic disease, which means that in order for someone to actually acquire it, they must have inherited the defective gene from both parents. So those with cystic fibrosis often suffer a range of issues, which can affect many of the body systems, including the lungs, pancreas, and also the sweat glands. Cystic fibrosis affects the exocrine system by mutation of the FTR protein, and this particular protein is responsible for regulating the production of things like saliva, sweat, and also tears and mucus. So this protein is identified as a channel protein, so it's just responsible for the chloride ions and their travel across epithelial membranes, which is really important for the balance of water inside and outside the cells. So this is what you can kind of see represented in the top right hand corner of the screen. So those with cystic fibrosis, obviously the FTR protein is obviously impaired, which can lead to or actually decrease the ability of water to hydrate the cellular surface. Ultimately, this will cause mucus secretions to become really adhesive and thick, and this mucus can then obstruct passageways in the lungs and lead to breathing difficulties, sputum production, frequent clearing of the throat, and decreased pancreatic secretions of digestive enzymes. So how it actually progresses, so its effect on the pulmonary system remains the primary cause of disability and mortality in affected patients. So the buildup of thick and adhesive mucus in the airways makes affected patients more susceptible to chronic embryological infections and also inflammation. So this is caused due to the buildup of mucus, which produces things known as mucus plugs. So inhaled bacteria can actually get stuck in these plugs, which eventually causes chronic infections, and the body's immune system will then attempt to destroy these pathogens by initiating an inflammatory response. However, this causes progressive fibrosis and eventually damages the airways and the development of bronchitis, which is permanent enlargement of parts of the airway. So when this FTR protein is impaired, it can also actually decrease pancreatic secretions of digestive enzymes, and this results in formation of tissue fibrosis. So this causes malabsorption of food and causes the digestive tract to pass partially undigested food, which can obviously result in an array of different issues, from abdominal pain, constipation, weight loss, and also diabetic development. So moving on to infertility, it's been highly cited that about 98% of men with cystic fibrosis will be infertile, and this is mainly because the tube that carries the sperm, called called vas deferens, which I've pointed to in this slide, is either missing or it's actually blocked. So there's nothing wrong with the sperm, it just can't reach the semen. However, this can be treated with IVS treatment. Women, on the other hand, normally only suffer infertility due to the fact that they are likely to experience irregular periods due to illness and also weight loss. So the role of exercise. Exercise is now more commonly being used for mucus clearance treatment, and increased mucus clearance can also help prevent recurrent lung infection by decreasing the buildup of these mucus plugs. Both aerobic and resistance training can increase the forced vital capacity, which is really important as it's a primary determinant for the disease's progression, and it can also increase muscle mass, which is significantly important for good posture in order to eliminate other comorbidities such as joint pain and excessive kyphosis. Any type of weight-bearing activity also has the ability to increase the patient's bone mineral density, and this is significantly important in patients with cystic fibrosis as the condition actually decreases the production of bone mineral density due to pancreatic deficiencies. Flexibility is another important part of the management plan. It is particularly helpful for improving posture and breathing. So when the body has to use the trunk muscles excessively for breathing and coughing, the individual's posture will actually start to be adhesively effective. So paired with pulmonary symptoms of cystic fibrosis, the chest pressure can actually increase and can push outward on the skeleton, leading to curvature of the spine. So overall, exercise is really cost-effective treatment for families with cystic fibrosis members, and obviously the earlier you implement physical activity into the patient's life, the better their later life prognosis will be. So going on to exercise management plan that I've created. So just before I get there, I'd just like to highlight there's actually really limited resources about the intensities and also the guidelines. Mainly, it's been highlighted that there's possible benefits of aerobic resistance and flexibility training, yet there currently is enough research evidence to create these guidelines about how to go about it. So my management plan is basically based on previous studies and what they've found to be beneficial for their patients. Firstly, we've got aerobic training. So I think it's really important that the patient partakes in this aerobic exercise to improve, or rather to maintain their forced vital capacity, which is a major determinant of the disease's progression, and also will increase their tolerance to dyspnea, which will lead to improvements in aerobic fitness and possible improvements in self-esteem through achievement. It's recommended that they perform this type of exercise 3 to 5 times a week, but because this particular management plan will also incorporate resistance training, and cystic fibrosis patients particularly have a really full week involving different types of therapies and treatments, 3 times a week will still be efficient. 30 minutes per session, again, has been recommended due to their busy schedule, and the intensity of the sessions should be about 50% of their peak oxygen uptake, or between about 70 to 85% of their maximum heart rate, and it should be noted that this is recommended for people with mild to moderate cystic fibrosis, not severe. So a good rule of thumb is to use a talk test, so if you're able to carry on a short conversation when exercising, this is a good intensity. Here I've allocated running, cycling and swimming as possible aerobic training modes. However, with her current age, she may also participate in a community sporting club. Thus, one of these sessions could be replaced with a game, as this would still involve high aerobic stress as well as possible training depending on the intensity. Looking at the resistance training program, we know that she's been using corticosteroids, which has multiple side effects, including a decrease in muscle mass. So this highlights that resistance training is truly an important aspect of the exercise management plan. The main goal of this resistant program is to improve the patient's strength, but more importantly, endurance. And this is because both these attributes of fitness relate to the fulfilling of activities of daily living, particularly that of endurance, and thus this increases the ability to improve their quality of life. I've used knowledge about the correct guidelines to achieve strength and endurance in a healthy population to actually guide the development of this particular program, mainly through the correct amounts of sets, reps, resistance, and also rest. So previous studies have monitored or prescribed intensities of resistance training programs by suggesting that the patient's heart rate is maintained under 55% of their maximum. This resistant program should be completed about 2 to 3 times per week and should take no longer than 45 minutes. So again, being flexible due to their generally quite chaotic time schedule. This program represents the first 4 weeks of training, and the following programs would involve pyramiding. So this will be by increasing the amount of resistance and sets while also decreasing the number of reps. So this will aid in the continued improvements in strength and endurance performance. As you can see, when you look at the different exercises I've chosen, they do have an upper body focus. So while it's important that you improve the whole body strength, upper body strength, especially of the back, neck, shoulders, and chest and abdomen, have been shown to actually improve the elasticity and mobility of the chest wall, which is obviously going to be significantly beneficial for cystic fibrosis patients. Also, because she's going to be performing other weight-bearing activities such as running and walking, this will aid muscle development of the lower extremities. Lastly, we have flexibility training, which is another really important mode of exercise management plan, as it's important for posture and to keep a full range of movement, and also decreases the chances of injuries. So the patient is able to achieve flexibility through a normal stretching routine at home, as well as yoga and Pilates, which have obviously become really popular over the recent years. Yoga and Pilates also have an added strength benefit and component, which may be the reason that this is the recommended medium for flexibility training. Being able to complete some sort of flexibility training 3 times per week has been highly cited to be the minimum frequency for improvements, and stretches should include the whole body, but again, similar to the resistance program, have an upper body focus, particularly with the chest, torso and lower back, and it should be held between about 15 to 30 seconds and do about 2 to 4 reps. So obviously this is something that you can start lower and build up. And to measure intensity, they should not feel any more than a mild to manageable discomfort. So here on the right of the screen, I put together 6 key stretches that can be done at home with accompanied a few other stretches of their choice. So there's a lot of special considerations that we need to consider for cystic fibrosis patients, and particularly, firstly, and the major one would be hydration. So those with cystic fibrosis lose more salt through sweat compared to the general population, and thus are put at a greater risk of dehydration. Dehydration can cause secretions to become thicker, making the airway clearance and breathing more difficult. So therefore, it's recommended that they train in a hydrated state, avoid extreme weather conditions, and also drink a rehydration drink that contains moderate amounts of sodium and chloride. Cystic fibrosis patients are also particularly susceptible to bacterial infections, so therefore it's really important that they practice and maintain good hygiene in the gym. When exercising, it's also really handy to have tissues that are accessible because they have increased sputum production, and nutrition is also really important. So although we're not dietitians, it's really important to highlight basic nutritional needs. Weight loss is really not a common goal for people with cystic fibrosis, as many of them are normally actually underweight due to atrophy and also the high energy needs compared to the general population. So they should, we should actually emphasize the need to increase the fat and carbohydrate consumption prior and also after exercise. We also have to be mindful of incontinence. So due to excessive coughing, many have weak pelvic floor muscles, which can lead to leaking when performing high impact activities such as jumping and skipping. And lastly, like I've mentioned in previous slides quite a few times as well, you must really take care when adding additional disciplines into the patient's treatment program. This is mainly so it doesn't become a burden or too onerous and create resistance. Onto the journal article. So this study was actually published in 1987, so it is quite old, but like I've said, there isn't very much resources out there about exercise management plans and cystic fibrosis patients. So the aim of this study was to discover whether a weight training program would lead to a significant increase in weight gain, muscle size, strength, and improved pulmonary function in patients with cystic fibrosis. So this particular study contained 6 men and 3 women with cystic fibrosis, and the mean age was 25, so they were all post-pubertal. So this would probably be one of the downfalls of this particular study in relation to my exercise management plan. The study required 6 months of variable weight training conducted 3 times per week, and they also used measurements to see if there was any improvements by including things such as body weight, anthropometric measures, and also muscle strength and pulmonary functional tests. For the first half of the program, each workout involved a circuit containing both free weights and machine weight exercises, and the goal during the initial period was to increase strength and endurance. So they were thus instructed to use lighter weights that allowed them to complete a higher number of reps, which is something that I've also applied to my training program. During the final month, there was a change in the workout for each session in order to further increase the strength and muscle mass, and this is where they used a pyramiding technique. They also had an upper body focus, as they also highlighted the importance of upper body exercises to increase the size and strength of the muscles to improve flexibility and mobility of the chest wall. So I have also included this upper body focus in my resistant program. So in the results, so at baseline, these patients had moderately severe cystic fibrosis, and after the program, there were actually really significant changes on several outcomes. So the residual volume and the residual volume total lung capacity ratio improved significantly. However, unfortunately, no other pulmonary function changes were significant. There was also a significant increase in body weight, muscle mass, and also strength, with the average increase in body weight by about 2.88 kilograms, and also strength at baseline had actually doubled. So in conclusion, their results support their hypothesis and proves that a 6-month weight training program can increase weight gain, muscle mass, strength, and pulmonary function in individuals with cystic fibrosis. Furthermore, the actual changes in the residual volume that they found further supports the theory that exercise should be used as an adjacent treatment for patients with cystic fibrosis. However, the small number of self-selected patients and the limited duration of the study, it's obvious that the results need more confirmation by more longer randomized controlled trials of varied weight programs with cystic fibrosis patients. So in conclusion, I just want to highlight that I think that exercise is obviously a really valid treatment for cystic fibrosis patients. However, though, many journals and campaigns advocate exercise, the literature highlights that it's often poorly and sporadically implemented. So we still need these guidelines to be actually developed so then people know how to implement them a bit more accurately. So obviously there needs to be a bit more research. Treatment and management can be very expensive. So exercise can be used in conjunction to these treatments to actually enhance their effect and decrease the need of some medication and therapies. So lastly as well, I think children with cystic fibrosis, it's really important to get them active as soon as possible so it becomes a bit more habitual and the deconditioning process will actually slow down. So it can also improve their quality of life by increasing their self-esteem and empowering them to partake in physical education and games with their peers on a more regular basis, which would ultimately enhance their social life. Thank you for listening to my study.